Hello and welcome back to KXAN Plus. I'm your host, Esmeralda Zamora, and today we have our Simple Health stream with our KXAN Simple Health expert, Jose Torres. Jose, thanks so much for joining me. How are you doing?
I'm doing great, Esme. How are you?
I'm doing awesome, and I'm glad to be talking about Simple Health again with you, of course. Before we start, I do want to ask you to share with our viewers what Simple Health actually means and why we cover these types of stories here at KXAN.
Well, I suffered a stroke about almost 6 years ago. And so when I was doing some research about how to take care of myself, I found like a lot of information is out there, and then some of it is just too complicated. So that just inspired me to focus on some producing some health stories here for KXAN. And we have this brand of Simple Health. And what we try to do is just try to make it more digestible for you and empower you with information.
That's awesome. Well, Jose, today's story is about a major step that medical experts have taken in eliminating HIV. This new step has just been approved by the FDA. What can you tell us about it?
Yeah, it's very promising. The drug maker of this new injection called lenacapavir, the drug maker says clinical trials show that the drug during the trials nearly eliminated HIV transmission among the participants who were part of that trial. So I spoke with a couple of leaders here in our area to get their reaction about the impact that this drug will have in our community. I spoke with Eli Oldham. He's the ride director for the Hill Country Ride for AIDS. And I also spoke with Christopher Hamilton. He's the CEO of Texas Health Action. And here's a piece of that conversation.
You only have to see the doctor for that injection twice a year. And that's a big change for people. One, that you don't have to remember a pill every single day to take. And two, for people that may have barriers to taking daily medications. Maybe somebody is unstably housed and trying to store medication and take it around the same time every day just isn't possible. We're just starting work on developing the pathways, protocols to make sure that patients receive all the care they need to be supported in staying on this medication. We don't have a timeline yet, but we are beginning our work on this to make this an option available for people. Payment for these kinds of things is going to take some time, right? Insurance coverage does now offer coverage of daily oral medication, daily oral PrEP. It will take a while for insurance companies to sort out their policies on whether or not they are going to cover an injectable version. Right now, it does take a medical exception, meaning your doctor is going to have to write to that insurance company and detail the reasons why this injectable version, is better for the patient than a daily oral medication.
I've gotten to be lucky that I've been a part of it for so many years. So my name's Eli Oldham, and I'm the ride director for the Hill Country Ride for AIDS. It takes out in Spicewood, Texas, at this beautiful place called Krause Springs. Funding is going to be a big part of helping people get access to this medication. And the Hill Country Ride for AIDS is one of the things that, one of the events that helps to fund 9 different nonprofits here in town. We are going into our 27th season. When PrEP and all those medications first started hitting the market, they were also really expensive. And so I think that we're, hopefully in a shorter game now.
It's going to take us some time to figure out at what price we would be able to purchase this medication, and if that's something that would be feasible to do through donations or grants. With that very high initial price, that's not something that we would be able to do right now. So again, over time, we hope that those prices will come down. We hope that through our nonprofit and designation, as well as some other factors, that we would be able to purchase those at even less cost than the publicly available cost. This new injectable PrEP for HIV prevention really is going to be a game changer for a lot of people.
It's very exciting. Anytime that there is a breakthrough or change or new treatment for HIV, it's exciting because it's always about the progress that's coming.
Jose, there are still a lot of unknowns when it comes to the cost of this medication and if insurance will cover it, what that price will be once insurance covers it. Did the Texas Health Action say when the drug might be available at the Kind Clinic?
So they are currently still checking in on that. So right now there's still no timeline. And The drug, the FDA approved this drug in June, in around early to mid-June. So it's still too early to tell when when KXAN Clinic will be able to get those injections for people. And again, no word yet on when how much insurance will cover it or whether they will cover it. But based on previous treatments like those daily pills that they mentioned, those eventually are covered. They are covered now. So the hope is that insurance companies will. And this is just to give you some news about how much this injection cost. Out of pocket is $14,000 per one shot. And with this treatment, you have to take one shot every 6 months. So that's almost $30,000 a year to get these 2 shots. Something that I didn't know that Christopher explained to me was that the shot has to be given to you by a health provider. You just can't get a prescription and
do
go
it
to the
yourself.
pharmacy.
Yeah.
So here's how Christopher Hamilton explained the rest of that.
But again, this has to be administered by that provider in the office. So there's only a few pharmacies that are going to be able to actually carry this medication. Now, we're very fortunate at KXAN Clinic to have an Avita pharmacy located with our 2 KXAN clinics in Austin. So we'll be able to receive that medication from the pharmacy and administer within the clinic there. But you won't be able to just go to your local pharmacy, take it home, and do the injection yourself. There are other specialty pharmacies. The distribution of this is only through a specialty pharmacy right now. So some of the national retailers have a specialty pharmacy that's different than maybe the one that you think about on the corner. Some of those are specialties, some are not. And you may have to ask your provider to be able to identify that specialty pharmacy. And then that pharmacy is going to be able to deliver that medication to that doctor's office to then administer.
It's clearly a very new drug, so there's a lot of questions. Things are still being thought out with this medication. Before, when we were watching that package that you created, we saw a clip from having to do something with the bikes in the hill country. Tell me a little bit more about that.
Yeah, so the video you're looking at now is just some of the video we've gathered over the years of the showing you the Hill Country Ride for AIDS. The event has been going around for almost 30 years. In April of 2026, it'll actually be the 27th event. It's a huge, big fundraiser. They raise money for 9 nonprofits in our area that help with support services for people living with HIV or AIDS. One of those nonprofits that benefit from this ride is KXAN Clinic. The bike ride is a lot of fun. So I spoke with the director, Eli Oldham. He shared some photos and talked about the magic this event creates throughout the year and how you can benefit. And even if you are just wanting to take part or maybe even volunteer.
The ride is really one of those things that it's easier to show than it is to actually, it's easier to show than it is to talk about because the ride is so special. We have all these themes this past year. We had a Wizard of Oz theme, and so even our golf carts were really decked out by our volunteers. And we just have so many types of people that do it. We've got wonderful volunteers this year, so we always have a little bit of an extra theme to it. And then, here's another one. It's me dressed up like the scarecrow at the very beginning, but our different distances, we have all these folks that do it. So this is our 75-mile riders, and then the next ones are the 45 and the ones after that. But it really is something that is so incredible to be a part of. I've gotten to be lucky that I've been a part of it for so many years. I've got to meet people who've been doing it forever. I've also get to see all the new folks that come in. It's also just kind of special to be connected to this kind of link to the past that helped to get the community through so much and is still doing that work, which obviously we still need. It's called the Hill Country Ride for a reason. It takes out in Spicewood, Texas, at this beautiful place called Krause Springs. There's actually 4 different distance options. So you can do 13, 27, 45 or 75 miles, so just kind of bigger loops that all start and stop at the same spot. And really, it's I call it kind of a self-led pride parade. We have a pit stop about every 10 miles. The ride itself is kind of a thank you and a celebration for the hard work and fundraising people have done all year. And so the day of, people are well prepared. We also have a lot of support to help people get ready for it, but there's costumes. There's a lot of community that encourages people just having a good time, making sure they feel better about their fundraising. The fitness part of it is there too, but really it's just about helping people out and being a part of this cause, and also getting to see people that you've got to do this ride with year after year. Sometimes we have people who dive in for it. A lot of our folks are actually here from Central Texas, but it's a community that kind of comes together like a reunion every year. So it's going to be April 18th. It's coming down the road, and yeah, this is my about my 16th year participating in it, and I love it so much. I wouldn't be doing what we do if I didn't think this ride was really impactful, and it touches people in so many different ways, not just the fundraising, but also just the fellowship that comes out of it as well. So the ride is not necessarily team-based, but the teams are what help to make the ride so special. So there are tons of people who do the ride without a team or just in pairs or something like that, but team fundraisers, team bike 101s, things like that, bake sales, all these kind of events to help people fundraise for that. And just, cycling has been something that has brought people together for a long time, because if you're riding safely, you're not on your phone. And so you just kind of are next to the person on the bike riding. If there's no traffic, you get a chance to have conversations with people. It's one of those things where we always talk about kind of bonding through suffering. So yes, it's very hilly. We prepare for it. Your legs do burn, but ultimately it's one of those things where at the end of the day, you can celebrate all the hard work you did, the people that you've helped, and the friends that you've made. And if you are a kind of person who is a little nervous about jumping into it, that's why we have a whole season to it's very plug and play. We get people into it, and I guarantee you we're gonna have people who are gonna say hello to you as soon as you walk into one of our events.
That sounds like so much fun, Jose. You were just mentioning to me off camera that you're interested in participating in this event. What do you think would be the biggest challenge?
The hills. The hills. I think I have strong legs as a runner, and the strength training that I do, but I don't. Doing actually on the bike and going through those hills, I'm sure I'm going to have to get off the bike and then walk that hill up. So I'm looking forward to it, and it is so picturesque. If you haven't been there, it's a beautiful part of the hill country. They do it out in the during the spring, where the weather is not so hot and humid like it is right now. You can bring your friends. You can volunteer. They have different pit stops where you can also volunteer there and hang out with the bike riders, and or get a bike or rent a bike and join. The group Hill Country Ride for AIDS, they have some group bike rides, and they have I guess you can call them like little workshops or rides for beginners as well. I have all of that information with the web story. I have a link to their registration page where you can learn more information about their upcoming race in April 18th of 2026.
And we will see you there, Jose. I really want to know what that theme is, because I know you're going to go all out for that theme.
It'll be fun.
I bet it will. So recapping, we talked a little bit about the new medication that is out for to prevent HIV. If any of our viewers dropped out or just dropped in, give us a little recap as to what that medication is, what it does, and when it'll be available.
So the FDA in June approved this new injection that you have to take once every 6 months. And based on the studies from the drug maker, it showed that it nearly eliminated HIV transmission among people who were part of that study. The tricky part right now is that we don't know if insurance is going to cover it right away, or if they do, how much they will pay for it. The other tricky unknown is when KXAN Clinic, one of the clinics here that offers treatments and support services for people living with HIV and AIDS, they don't know yet when they will have the injection. And right now, without insurance, it costs $14,000 per shot, and so you have to take 2 in a year. So that comes out to less than $30,000 out of pocket. And the other part of the story is funding the Hill Country Ride for AIDS. It's a fun bike ride. They raise money for KXAN Clinic and other nonprofits here in Central Texas that help people with HIV or AIDS.
Yeah, and this is it's a breakthrough. It's groundbreaking. I think the only other HIV prevention medication that was out there was PrEP, the oral medication. So this is completely different, right?
Right. There is one less talked about injection that came out, I want to say, about a year ago or two. I'll get more clear on that. But yes, and prior to that have been the daily pills from Truvada and other brands out there.
And it's already been approved by the FDA, so it's just going to take a little bit longer to get the process rolling and more information out on this new drug. Jose, your article is on our website, KXAN.com. Viewers can find that on the homepage. If you're interested in learning more about this medication or even the fundraiser event that Jose will be going to next spring, it'll be on that article. Thank you for joining me, Jose, and we will see you next Monday.